not even really talking about what the broader causes of thumb dysfunction are, beyond common sort of tropes like overuse or age or arthritis and things like that. G'day and welcome back to the channel. So in today's video, I want to talk to you about something really interesting that I'm finding clinically about my thumb pain patients. Now this can be anyone who has potentially thumb arthritis or osteoarthritis, but anyone that has like a general ache or a random dysfunction in one or both of their thumbs. And again, I think this is really important because as soon as we start to develop thumb pain, I think most people's default is to feel or be told that you may be developing some arthritis in those thumbs. As soon as you're given that label of arthritis or something like that, it gives you the impression that things are permanent. But this generally isn't true, because what we know about something like arthritis in this instance is that you may have an arthritic thumb potentially on an x-ray, but that doesn't tell you how your thumb has to feel. It just shows you how your thumb looks. An x-ray alone is not a good diagnostic tool to explain pain and the presence of pain. So what I want to do is I'll talk about what I'm finding, and then I'll show you a really interesting exercise, a really helpful exercise to hopefully rectify that, so that you can hopefully test this out for yourself. So you don't have to take my word for this. I don't have to promise anything. We can just base this on results, and hopefully you can see the same things that I think my patients are finding as well. So the first thing to talk about is what your thumb pain may actually be. We often seem resigned to the fact that it's just a thing that we experience as we get older. Maybe it's age-related, maybe it is wear and tear, maybe it's arthritis or something like that, as I said before. But we often neglect to try and understand why that specific part of your body has become dysfunctional. There has to be something going on behind the scenes that we're sort of overlooking or neglecting that's piecing all this together. And for me, clinically, what I find is the answer generally lies in the neck. And that may sound strange because the thumb is almost literally the furthest part of your body away from your neck. But the answer generally lies in neural connections. And that can be a specific nerve, like say the radial nerve, for example, which comes from the base of your neck as it exits a bunch of different segments, goes down from your armpit, down the back of the arm, down the outside and towards your thumb. Or it can be from something called dermatomes. And I've spoken about dermatomes previously, but what dermatomes tend to be, they are specific sections of our body which relate to specific sections of our neck. And what I tend to see clinically with my patients is that by checking out their thumbs, getting a baseline on their symptoms, by hunting around their neck for any joint stiffness, any muscular tightness, any dysfunctional tissue or poor loading in that area, and by changing that within the session, we can see some tangible improvements in either the strength of the thumb, the symptoms of the thumb, how tight it feels, how loose it feels, without touching the thumb. And what this is potentially showing me, anecdotally at least, is that the neck or that hidden neck dysfunction, and again, you may not have a sore neck at all, but the presence of some underlying hidden restrictions and dysfunctions at certain levels of your neck can set the thumb up to become dysfunctional and sore over time, potentially. So what I want to go through next is I want to show you how to figure this out for yourself. So again, I don't want you to take my word for this. I don't want you to have to trust me on this. I just want to give you this information in a way that you can use it to your advantage and then assess for yourself whether you feel this actually makes a difference. So when you do this, please let me know in the comments down below straight away. Tell me whether you A, thought that this was possible, but B, found a spot in your neck that communicated with your thumb, but more importantly, changed the way your thumb felt without touching your thumb. And the best way to do this, again, if you've been in part of the channel for a while now, you'll know what we like to do here, is we want to take a ball of some sort. This is a lacrosse ball, you can use a tennis ball, anything that you feel gives you access to understanding what's going on in your neck. And before we use the ball, we want to make sure that we take a few very obvious baseline measurements so that you can compare things to this afterwards to gauge any genuine progress. So that might mean just moving your thumb or thumbs around and taking note of how tight it feels, how uncomfortable it feels, whether there's a general ache there. Grab something, squeeze something, take note of how strong you feel, move something or do something that you know irritates your thumbs or lets you know that your thumbs aren't perfect first, because we're going to come back to this at the end, and then over time, over the next couple of days, to make sure that you can pick up on any discernible change from using that ball. So what we want to basically do is we want to take the ball, and we want to go hunting basically from the midpoint of your neck and sort of like the mid-shoulder blade area. These sections of your neck can form the nerves that supply your thumb, but can also have the dermatomes that connect to your thumb area. So a great place to start is if you find the bump at the base of your neck, that's C7, that's the lowest segment of your neck, I want you to start on the bump and then just roll straight off to the side. So we're not on the bump for this, we're just off to the side. And we're going to gently move the ball up and down segmentally, looking for areas that might be stiff, tight, restricted. Again, it may not be painful at all for you, but we're looking for something that may connect to your thumb. And what we also may see is that when you put the ball in a specific area that might be related, you may feel like something's happening at your thumb. It doesn't happen for everyone every time, but if it does happen for you, that is a dead giveaway that the section that you're on may be contributing to your thumb pain and symptoms. And it's a dead giveaway that you need to make sure that that section of your neck gets better over time. But for everyone else, those tests and retests that you will do before and after this are the measuring stick for progress. But again, once you've found that spot, start at the base of your neck there. Again, just come off to the side that you feel your thumb is the worst on. And what we want to make sure that we do here is, again, as we always do with these exercises, we just want to get a sense of whether this feels stiff, tight, restricted, or tender. We want to compare that to the exact same spot on the other side, because again, we don't know which side is the dysfunctional side until we put a ball in there. And even if you have all of your thumb dysfunction on your right-hand side, but you feel like the joints and the tissue on the left-hand side are more obviously dysfunctional, we want to treat that side more than the other side, because your body doesn't think of you as a left and a right, it just thinks of you as a neck. So if you have any dysfunction in your neck, it can affect both sides in theory. All we're doing here is we're just finding a spot that maybe feels a little bit stiff and restricted. I've got one here. Just want you to stay here for 30 seconds, a minute. Stay here for as long as you feel it takes for that tissue to maybe give a little bit. Remember, it may not hurt. It may just be a little bit tight and restricted. It may not sink in as well as the other side. Once you've had enough there, move the ball up a tiny little bit further. Go looking for the next spot to release and to free up. And then what we can do here is then just move the ball up and down, looking for anything that may give you some thumb symptoms, but more importantly, something that feels a little bit stiff, tight, and restricted. Because again, once you've done that, you spend some time working up and down those areas, you can immediately recheck your thumb movements, your thumb activities, and gauge whether something has genuinely changed. And again, you might find that there is a subtle shift in something. It may feel stronger, it may feel a little bit less sore. That is what we're looking for instantaneously. Because if you're going to keep doing this over time, over the course of the next few weeks, you need to make sure that you're not wasting your time. Once we've had that conversation about maybe your neck potentially being connected to your thumb, and we've given you a tool to hopefully free up that tissue and some assessment ideas to make sure that you can gauge that progress, the last thing that we need to talk about is always one of the most important things to talk about on this channel is if you know that one section of your neck is causing your thumb to be dysfunctional, we need to ask you, why is that section of your neck becoming a problem in the first place? Why is the exact level that you may have found that's important become a problem and not the one above or below or the one on the other side? And generally, from what I would find clinically, and having asked this question for about 10 to 15 years now, the number one cause of any sort of spinal dysfunction that I see tends to be seen in the shapes and the positions that you get into day to day. And again, although there isn't a lot of research to suggest that poor posture leads to pain, there's some very compelling clinical evidence to suggest that the positions that you put your spine into causes specific dysfunction over time. So for example, if you know that this exact junction of your neck, where your neck sits on top of your back, is the level that's causing your thumb to be uncomfortable, it's very likely that day to day, whether you're sitting at a desk, whether you're very active, doesn't matter, we're looking at a central theme of where you put that tissue or the position you put that tissue into. It's very likely that if that's become really stiff and tight, that you are looking down in a way that includes and biases that part of your neck more than the joints above or below. So again, you can be someone who's really fit and active, but if you sit at a computer all day or at a laptop, or if you're on your phone all day, or you read a lot in this position, or you play an instrument, or even if you stand up, you're working really hard looking down at a workstation, or you're in a kitchen, whatever it is, there has to be a reason why one section of your neck is more dysfunctional than another. And if it's one-sided more than the other, there may be some element of rotation or asymmetry within that shape that biases that part of your body. And again, it's really important to have that conversation with yourself, because if you can't pick up on those random shapes that you might be getting into and take the time to try and improve those shapes, improve those positions, then again, it's unrealistic to expect that that tissue will magically stay loose and stay free with all of your hard work. So obviously there's some other things involved in terms of strength and obviously treating your thumb and making sure your thumb specifically is going well. But I just wanted to point that out because I don't think many people A, have realized that the neck may be contributing to thumb dysfunction. B, we're not even really talking about what the broader causes of thumb dysfunction are beyond common sort of tropes like overuse or age or arthritis and things like that. So I genuinely hope that that was helpful and useful for you. Again, let me know in the comments down below. I genuinely want to know if you can find some of the same things that I'm finding clinically. If you did find it helpful, please slap a like on the video, subscribe to the channel if you're new and you want to see more of me and this type of content. But if this did genuinely make a difference and it shifted the needle with some thumb pain that you may have been having for a long time, please consider leaving a super thanks donation on the video. It's just a great way to help support me and the channel and allow me to keep making videos like this. So with that being said, again, I sincerely hope that was helpful. Thanks for watching and I'll see you in the next one. Bye.